Healthcare in India is facing a crisis. Doctors and hospitals are under attack, and the government is cracking down. Negligence in BLK Hospital led to the death of a 9-year-old. Fortis Hospital charged a huge amount of 16 lakh rupees after 15 days of admission. Max Hospital in Shalimar Bagh lost its license after wrongfully declaring the death of a premature baby. These grim headlines pushed us to publish a piece on all that is wrong with Indian healthcare and how to fix it. We were fortunate to get a contribution from a senior medical practitioner on this topic, and the response we received was overwhelming. While you can read this story by clicking the link in the comments section, we thought it's worthwhile and perhaps appropriate to take this discussion to another level. Since we so often hear of precedents being given in India about how Western healthcare systems are better, we thought it's worthwhile to invite a US-based specialist to give his take on this entire situation. So we have with us Auris Atreya. He's a cardiologist based in the US, and he has a public health degree from Johns Hopkins University. And Auris is going to talk to us about all that is wrong with the Indian healthcare system and how it compares versus the system in the US, and what can we borrow from there and what are the traps that we need to avoid. So Auris, what do you think is the real reason for all this outcry in the Indian healthcare system, in the sense that both sides have some valid points, the patients or the kin of patients as well as the medical community? So where do you really draw the line?
Well, Nikhil, I think the real issue here is a system level issue. The root cause of this is a lack of a quality and universal healthcare system. And short of a major reform or overhaul, these kind of flashpoints will occur in the future too. So if you're a patient in India, what options do you have? One option is to go to a government health setup, which is often overworked, the resources don't meet demands, and you may get quality tertiary care. You may get quality tertiary care in some settings, but for the most part, tertiary care doesn't even exist in the other settings. And while it is affordable, timely quality care may completely elude you. The other option is to go to a private health center, and in fact 75% of the secondary and tertiary hospitals in India are privately run, and 75% of expenditure is in the private domain. And here you may receive timely, efficient care, but at a high out-of-pocket cost. Now, it is important to see why is private healthcare more expensive. One of the issues is they really receive no financial incentives from the government. Secondly, they're run as a business venture. The motivation is to make a profit. And all of this translates into high out-of-pocket costs for patients and their families. Now, imagine if you are hospitalized with a serious illness and the hospitalization runs long. It is only natural that the bills keep rising. And if unfortunately a patient then passes away and a large outstanding bill is presented to the grieving family members, anger will erupt, and this is only natural.
So what exactly is the government doing?
Well, the government has traditionally provided subsidized or free healthcare, but it has largely retrenched from the secondary and tertiary healthcare sector. And its focus really is on basic primary care, particularly in the rural areas where they are the sole point of healthcare contact. In fact, it is well known that in India, the percentage of GDP that is spent on healthcare expenditure is less than 2%, which is grossly inadequate. Even this care is largely at healthcare delivered at the flagship teaching institutions like the AIIMS, the PGIs, the JIPMERs, and the government teaching hospital in every major city. This is just not enough, and people don't have much of a choice in the government run health sector.
So, I mean, like you mentioned primary, secondary and tertiary healthcare. What do you exactly mean by them? What's the difference?
Well, primary healthcare is the first point of contact between a patient and the healthcare sector. You know, this is usually in the outpatient setting and includes all kinds of common problems, treatments for common problems such as the cough, the cold, even the treatment of chronic conditions such as high blood pressure or diabetes. And this should be universally accessible in the rural areas and the urban areas. Secondary healthcare is treatment of more acute conditions. This is mostly hospitals and emergency medical center care. For example, the treatment of an acute asthma attack or the delivery of a child is considered secondary healthcare. Tertiary care, on the other hand, is almost exclusively specialized healthcare or consultative care. This may include advanced surgery, advanced cardiac procedures, advanced diagnostic modalities, and is delivered in larger hospitals. Few government centers, but mostly private sector.
So what do you think is the trend in India in terms of which particular type of healthcare are Indians moving towards?
Well, I think there's a shift from communicable diseases to more lifestyle diseases, which may require more specialized care.
So you're saying that more and more people in India are dependent on private healthcare centers for their requirements?
Well, I think they're forced to because of the sheer paucity of quality specialized setups within the government sphere. So they end up going to the private hospitals or clinics for this sort of care, and unfortunately this increases the cost of treatment.
Right, but I mean, isn't insurance supposed to cover all of that?
It should, but unfortunately in India the health insurance penetration is abysmal. It's actually one of the lowest rates in the world, standing at less than 4%. The promising thing is the health insurance market seems to be growing pretty well, 20% plus every year, but still a large number of Indian families are exposed to catastrophic health expenditure.
So how exactly is the model different in the US?
Well, the US health model also has a large private presence. They in fact account for 80% of the hospitals. And if you look at these 5,000 hospitals, secondary and tertiary care, they are linked to numerous primary care clinics. So as a result, the access to care is much greater because these primary clinics then refer their patients to the secondary and tertiary hospitals. Additionally, the first responder system, which is the emergency medical technicians, that network is really well developed. So there's rapid medical contact. I mean, it's a good system with a good structure, but all this would be of no use if you can't pay for it. And I think that's where the difference lies between the US and the Indian health system. Firstly, the health insurance coverage is significant in the US. It's over 90% of the population is insured, and since the Obama era, it is mandatory to have health insurance. Secondly, a large part of the responsibility for healthcare spending is taken up by the government. If you look at the various health insurance programs, 65% of healthcare spending actually comes from the government, and this is for the people who really need it, the old people, economically backward people, children, active and ex-military. So I think that's where the real system difference lies.
Right, but I mean that sounds pretty perfect, no?
Well, no, I wouldn't say that. I think the American system has problems of its own.
So Auros, what in your view are the issues?
I think the biggest issue is really the cost of healthcare. The cost of healthcare is exorbitant. And even though a lot of people have health insurance, paying for those health insurance premiums may not be that easy. Health insurance coverage may have a ceiling effect, or there may be gaps in coverage.
But Auros, tell me, why is the expenditure so high?
I think there are several reasons driving this. Largely, I would say administrative costs contribute to this. Because the system is built so much around health insurance. Every hospital needs several billing specialists. They need claim specialists to work with the various health insurance companies, managers for quality control mandated by insurance companies. So all this adds up. Additionally, as you know, physician salaries are higher than most countries. Pharmaceutical costs are higher than most countries. And finally, I would also say that there is a general culture of over-testing and over-treatment.
So lastly, Auros, what do you think are the key lessons for India?
Well, every country has its own model, and there are several things we can learn from the successes and failings of other healthcare systems. Few things that ideally need to come in place are increased state spending, especially in the secondary and tertiary healthcare sector. We need universal healthcare, especially for the rural and economically backward areas, because their options are poor right now. Financial incentives for private hospitals from the government, along with increased regulation to make healthcare cheaper but more accountable. Improved health insurance penetration so that families are covered. We need to shy away from defensive medicine practices, avoid over-treatment, over-testing. And this is really because there's fear of litigation, fear of personal physical assault, and safeguards need to be put in place to curb this trend.
Right. Thank you, Aras. Thank you for talking to us. So what should be the vision driving Indian healthcare? Shouldn't we aspire to be a society where every citizen, I repeat, every citizen can expect access to decent healthcare? Healthcare is a service which cannot be left to the freewheeling forces of capitalism. It is investment heavy, but should be accessible to all. We can learn from the mistakes of developed countries, but as Aras rightly pointed out, we need to create our own model. And in this model, we must take the doctors in medical community with us. Not by victimization, not by coercion, but by creating the right ecosystem and incentives. Hope you enjoyed this video. Please comment and subscribe to Transfin for receiving rich original news content from the world of business, finance, technology, and our economy. Have a great day.